How do you build your confidence? Like, how would a new student build their confidence and their skills in treating with craniosacral therapy?
So the craniosacral system is very forgiving and very adaptable to our lack of understanding. And I say that because when I first started out, I was very frustrated because it is hard. It's a subtle art. But I would have these patients that were complex, that had been in horrible accidents and horrible injuries. And so I would literally get out my textbook and lay it on the table beside the patient and read the instructions like a recipe. And
Mhm.
I had no real confidence that I knew what I was doing, but I would do the techniques that it said, okay, for this condition, do this. And I would do it. And many times, I can't tell you how many times I thought nothing happened and I felt completely a failure.
Yeah.
And the patient came back and said, I don't know what you did, but these 5 things have changed. And that built my confidence. So I would say that craniosacral therapy is very forgiving and it allows us to be beginners. We don't have to be masters tomorrow. I have done this for 30 some years and I'm still learning today, but I was very effective back when I had no clue what I was doing. So it's a hard thing. And I tell people about the paint drying story. Doing it is so different, but you have to get in that quiet space. You have to be comfortable with being quiet and trust that there's something happening. And your patients will confirm it for you. But from the inside, sometimes it just feels like, what am I doing and why am I doing it? The other thing about the craniosacral rhythm is it's very subtle. And so it's one of those things is, did I really feel that? Is that what I thought it was? Oh, there it is. Oh, I don't know. And then the next time you see the patient, you go, I don't know what I'm doing at all. And it's a common occurrence. And all I can say is trust that I'm not lying to you and that you will get better if you put in the work. And again, part of it I say in craniosacral too, the biggest restriction going forward is you, the therapist. You have to be able to be comfortable in that quiet uncertainty. And then once you've gotten to that point, the whole world opens up and there is so much there. But our self doubt gets in the way. And because it is subtle, we tend to self doubt. But it's very forgiving and your patients will benefit right away, whether you know what you're doing or not.
Can you just give us a brief kind of explanation maybe of what the craniosacral rhythm feels like?
Sure, of course. The craniosacral rhythm is driven by the production and reabsorption cycle of cerebrospinal fluid. So if you think about a balloon, there's an increase of intracranial pressure as that production cycle happens, as the cerebrospinal fluid increases. It floats the cranial bones in a particular pattern that's unique to each bone. In general, the filling phase or the pressure phase is called flexion or widening. The reabsorption phase is called extension or narrowing. In other words, as that fluid is recycled every 6 to 12 seconds, there is this rhythmic widening and narrowing of the cranial system. And you can feel that throughout the body. And it is subtle, but it takes very little time to become aware of it and then a little more time to become proficient at feeling that rhythm. But it is very powerful and it's there. It's behind everything that we normally do. It's not something you're aware of in yourself necessarily, but you can feel it on yourself if you lay in bed at night and put your fingertips on your maxilla. And if you quiet everything down and just put your fingertips on your maxilla, you will feel the maxilla widen and narrow, inflection and extension. And you actually put your fingertips on your molars of your top teeth and you'll feel maxilla widening and narrowing. And that's the easiest way for yourself to feel the cranial rhythm on you.
And can I ask the feeling, the change that you feel, is it something that your fingers feel or is it energetic feel? Like, can you expand on that
Yes.
feeling exactly?
No, it's a mechanical occurrence. It's not hairy fairy. It's not, woo woo. It's a mechanical thing that's happening. So you're literally feeling the cranial rhythm widening as that production cycle, as cerebrospinal fluid is produced. And you'll feel that cranial system narrow as that cerebrospinal fluid is reabsorbed. Every 6 to 12 seconds, it takes about a 12-second cycle for that to happen. And so your whole dural system is widening and narrowing, and all the cranial bones are floating. And that's how we assess the function of the cranial system, is how smoothly each cranial bone is moving, how smoothly the cranial rhythm is. And there's way too much to go into for this setting, but we can feel throughout the body how that cranial rhythm is transmitted through the dural tube to the pelvis, and we can assess the cranial rhythm anywhere on the body. And our goal is to smooth that out, to have it as powerful and dynamic as possible. And it's a mechanical thing. It's not energetic. It's a real thing that you can feel.
Okay, that was a great explanation.
I
Okay,
think we
stop.
make it too